are the first drug group? Cholinergic agonist. Okay. In this system, we use receptor M1, M2, M3. What special thing about M4 and M5 is present in these receptors present in brain? Okay. M1 receptor. M1 receptor, they link with the protein GQ. M3 receptor linked with protein GQ, and M2 receptor they attach with one protein GI. It's a one cell. Okay. The acetylcholine here. An acetylcholine attached with this receptor. If this receptor is M1, if this receptor is M3, then which protein activated here? Inside we having GQ. Okay. This GQ protein activate phospholipase C enzyme. Okay. This phospholipase C enzyme activate two systems. Number one, IP3. Number two, DAG. What stands for IP3 and DAG? DAG stands for diacyl glycerol. Okay. And IP3 stands for inositol triphosphate. Inositol triphosphate. What means DAG? The DAG stands for diacyl glycerol. Okay. So this is the second messenger system. These two second messenger system, they're doing what? These two second messenger system, they increase calcium. This is a very important thing to keep in mind. They increase calcium inside cell. Okay. These both systems, they help to increase calcium inside the cell. So what is the function of calcium inside the cell? If the muscle, then contraction. If the gland, then secretion. What is the location of M1? Yesterday I already explained. M1 present on stomach, parietal cell, yeah?
Yes.
So in the parietal cell, they're releasing what? HCl. So now the M1, you activate M1, you increasing calcium inside the cell. It's mean now you increasing release of HCl. Clear? Next. What is the location of M3? The M3 present on two things. Number one, exocrine gland. Number one, exocrine gland. Number two, smooth muscle. Okay. So if you increase calcium in exocrine gland, the exocrine gland doing what? Exocrine gland secretes saliva. Exocrine gland doing sweating. Yeah, sweat gland. Exocrine gland doing lacrimation in eye. Exocrine gland doing lacrimation in okay, lacrimation in eye. Lacrimation, sweating, saliva. Done. So if you increase calcium in smooth muscle, so what happened? Contraction. GIT peristalsis. GIT peristalsis. And in urinary bladder contraction. Urinary bladder contraction. Okay. You can understand easily. If you stimulate M1, what function happen? If you stimulate M3, what function happen? Inside the cell, calcium increasing. Okay. Okay. Now come to second receptor M2. One thing keep in mind: all the two receptors, alpha 2, M2, H2, D2, okay, 5H2, also one receptor 5H2. So these all having number 2, all are inhibitory. All these receptor having the attachment number 2, alpha 2, okay, alpha 2, M2, H2, D2, all these receptor attached with GI. So all these receptor are inhibitory. These receptors are inhibitory. Our concern just about this M2. The M2 receptor. So if you stimulate M2 receptor, which protein stimulated? GI. Okay. Inhibitory G protein. So this inhibitory G protein doing what? Decrease the level of CAMP. Okay. Decrease level of CMP, and this inhibitory G protein also open potassium gate. Potassium gate open. So if you open the potassium gate, where potassium going? You know, potassium inside very high. This potassium going out. Okay, if this potassium going out, what happen with the cell? Cell become hyper polarized. Cell become the basic concept of physiology. Okay, hyperpolarized. So now, if cell hyperpolarized, it means cell inhibited. If you hyperpolarize the cell inhibited. What is the location of M2? Tell me. Location of M2?
Node.
And the heart.
Yes.
Node.
Yeah.
SA and AV. SA and AV node. Okay. SA and AV node. So this SA and AV node, they inhibited. Understand? So what
Yes.
happened with heart? Heart
Decrease
rate. Now you easily can understand the effect. Okay. This one clear? Okay. Last
Yes.
thing to understand eye. It's very important eye effect. First you try to understand the anatomy, then very easily you can apply on eye these drugs. These drugs we use for GLT, these drugs we use for brain, these drugs we use for urinary system, these drugs we use for eye. Okay. First you try to understand the mechanism, general mechanism. Okay. In the eye we're having in center iris. Okay. This is a pupil, iris sclera. If it is a cross section of the eye. Here we having lens. Okay. This is the iris. This structure is iris. And this hole known as, you don't know about pupil. And here we having the muscle. This side and this side. This muscle, this tissue known as ciliary body. Ciliary body. Okay. Lens attached with ciliary body. What is this? This ligament known as suspensory ligament. Which ligament? Suspensory mean to hold something. Suspensory ligament. Okay. These are suspensory ligaments. Done. One thing. The lens. It's a pupil. So the pupil present between. What is this structure? Iris. Okay. This structure. iris. This iris, see another eye. If this iris contracted, sometimes pupil size decrease. Sometimes what happened, the iris contracted, this pupil size increase. It's a normal thing. Okay. If pupil size decrease, it means meiosis. Pupil size decrease, you can see here. Okay, it's a pupil. If pupil size increase, it means mydriasis. Okay, pupil size decrease and pupil size increase. Mydriasis and meiosis. Mydriasis and meiosis. Clear? Clear? The normal pupil. Okay, pupil size decrease, meiosis. Meiosis means constriction. Meiosis means constriction. Okay. Mydriasis means dilation. How this happen? Just because of iris. It's a hole between iris here. Iris having two type of muscle. Number one, circular smooth muscle. Number two, longitudinal, long, okay? They arrange in long, that like some muscle arrange like this, they longitudinal, and few muscle they arrange like this. Clear? There are two types of muscle in iris, circular and longitudinal. Iris having two types of muscle, circular and longitudinal muscle. Longitudinal, long muscle, longitudinal muscle. Which muscle? Smooth muscle. If circular muscle contract, then what happens? Meiosis. Okay. If longitudinal muscle contract, then what happens? Mydriasis. This concept clear or not? What the parasympathetic system, what doing inside the eye? In the eye, the pupil size change. Okay, pupil size change. Pupil size can be decreased, can be increased. How this increase or decrease? Iris having two types of muscle, circular muscle and longitudinal muscle. Parasympathetic system, which receptor? For muscle contraction, M3. Circular smooth muscle, these smooth muscle, here we having M3. Circular smooth muscle having M3. Understand? Circular smooth muscle having M3. So M3 receptor present on circular smooth muscle. If circular smooth muscle contract, what happen? No. So in eye, what happen with M3 receptor? In eye, meiosis. Understand? In eye, meiosis. Parasympathetic system doing meiosis. And now come on mydriasis. What is mydriasis? Mydriasis means, you can see here, pupil size increase. Yeah. In meiosis, pupil size is a pupil size decrease, pupil size increase. Okay. The mydriasis means dilation of pupil. Mydriasis means dilation of pupil. The radial muscle, longitudinal muscle. These longitudinal muscle, they having a receptor alpha 1. So alpha 1 not belong to sympathetic, parasympathetic. Okay, not belong to parasympathetic. Alpha and beta receptor are sympathetic. Already explained yesterday. Yeah, alpha and beta are the receptor for sympathetic. So if you using alpha 1 receptor doing contraction, what happen inside the eye? The smooth muscle contraction inside the eye iris. What happen inside the eye? Mydriasis. Clear or not?
Yes, sir.
What is mydriasis? Dilation of pupil. Dilatation of pupil. Clear? What is meiosis? Constriction. Okay. People become very small in size. People become bigger in size. Here we're learning the drugs of parasympathetic system. Yeah. So what is the effect of these drug on eye pupil size? What effect? What effect? Effect on eye pupil size. What happened with the pupil? If you're using drug for parasympathetic system, what happened with the pupil? Meiosis.
Contraction.
Understand? Meiosis. This meiosis, constriction. Okay. The remaining eye structure. Here come again with this picture. What is this structure? Anatomy. Oh, this structure is cornea. Yeah. This structure is cornea. Inside the eye, we have water. That water known as aqueous humor. Inside the eye, we having water here. Aqueous. Again, draw the picture here. Okay. Next picture is more clear. This structure, cornea, iris, this structure, cornea. Behind the iris, we having lens. Lens attached with the help of ligament. What is this structure? Ciliary body.
Everybody.
Clear?
Yes.
So this ciliary body, they produce water here. What is this thing? Pupil.
Pupil.
Okay. So that water name, aqueous humor.
Yes, humor.
Okay. So this water enter here in front of lens. Now coming here and then enter here, going here. So this is a junction. Yeah. What is this structure? Cornea. What is this structure? Iris. The junction between the iris is the cornea. Yeah. Cornea and iris. This water, this is a junction, this is an angle between cornea and iris. Clear? Angle between cornea and iris. And this aqueous humor absorb here. Okay. Absorption of aqueous humor at the angle between iris and cornea. The production done by ciliary body. Production done by ciliary body. Clear? And absorption done by this angle. From this angle, this water enter to vein. Okay. Here we having scleral vein and go back to vein. Understand? So if this angle close, anything happen with the production of liquid, anything happen with the absorption of liquid, what happen? This liquid, this free fluid becomes very high. Aqueous humor increasing. Okay. If you producing too much, production increase and absorption decrease. Yeah. Too much production done by ciliary body and absorption at angle. Which angle? Angle between cornea and iris. Clear? Angle between cornea and iris. Clear?
Please, sir.
Okay, now try to understand this concept. If you increase the aqueous humor, this disease known as glaucoma. Okay, glaucoma is a very common cause for blindness. If aqueous humor, too much water here, this water putting pressure on lens, this pressure shifted backward. Backside you already know having here retina. Yeah, retina. The blood supply of retina decrease. Inside the retina we having blood vessel. Okay, so if too much water here, too much water this is in this area, this water putting pressure on lens, lens putting pressure on backside we having vitreous humor, the jelly like substance, and this pressure can press the retina undergo disruption. Okay, the person blind, the glaucoma. Understand? So how you treat glaucoma? How you treat glaucoma? You must decrease aqueous humor. Understand? You must decrease aqueous humor. How you can decrease aqueous humor? You can stop production. One thing. You also can increase absorption. You can stop production. You can increase absorption. If you increase absorption, automatically aqueous humor will be decreased in the eye. Understand? What is glaucoma? Aqueous humor too much. Yeah, too much aqueous humor. Why aqueous humor very high? Aqueous humor production high and absorption little. So of course automatically this water become very high. If this water become very high and this water putting pressure on lens, and this pressure from the lens on vitreous humor, then pressure on retina dead. If retina dead, blindness. Understand? And if this vision not come back again, if retina once die, so it's a permanently blind for whole life. Clear? So these drugs very important for glaucoma. Okay, now again come back. Focus on this junction. Okay, what is this? Cornea, and this is iris. Clear? Here try to see the angle. This is the angle here. Okay, this normal shape. This is the cornea, and normally the cornea, the iris also like this. Okay, can you tell me where the angle is bigger? The picture A is the picture B. Where angle is more open? A or B?
The B1.
B1, yeah. B1 angle is more open, yeah. Understand? B1 angle is more open. If you dilate the pupil, this is the iris, here is the cornea. Okay. If you dilate the pupil dilate like this. Pupil dilate, very big pupil. You can see a very big pupil, yeah. If you dilate the pupil, so what happened with angle? Tell me what happened with angle?
Decrease in size.
Oh, angle become smaller. Understand? Angle becomes small. Okay, now can you absorb aqueous humor? Angle becomes smaller. Aqueous humor not absorb. Yeah, aqueous humor not absorb. Okay, next thing. Another picture here. This is the cornea, and now this iris becomes straight like this, and pupil now you can see pupil now smaller. Yeah, pupil now smaller. Here pupil bigger. What is this? Mydriasis. Yeah. What is this? Meiosis. Clear? Meiosis. When you do the meiosis, what happened with this angle? This is the iris, it's the cornea. Clear? This is the iris, it's the cornea. So if you do the mydriasis, angle small, angle become narrow. Yeah? Angle narrow. Is that good for glaucoma? It's not good for glaucoma. Person already have too much aqueous humor. Yeah? So if the angle become narrow, it's not good for glaucoma. If angle open, yeah, you can see here very big angle, here angle very small. So now you guys tell me, meiosis is good for glaucoma or mydriasis is good for glaucoma? You want to treat glaucoma. Meiosis is very good for glaucoma. Okay. Okay. Yeah. Meiosis done by which drug? Meiosis done by which receptor? M3.
M3.
And okay, mydriasis done by which drug?
menitnya dulu.
Mid-race is done by which drug? Alpha 1. Understand? Sympathetic system.
Kan dibuka terus sih. Lawannya
Guys
lho.
speaking, please turn off your
Caca.
Masa gak bisa nang pindah nang pinggir.
Caca. Telepon.
Ini ganti. Mas senden kena tau ya senden pinggir kok ya.
Safira Sabrina, turn off mic.
Enak. Cari ini memang.
Okay, the meiosis is very good for glaucoma. Mydriasis is not good for glaucoma. Okay, so we can't use sympathetic drug for glaucoma. So we use parasympathetic drug, M3 receptor. Okay, we stimulate M3 receptor and producing meiosis. Understand? So this group of drug very useful for glaucoma. The group of drug we use for glaucoma very effective. Very effective. Understand? This concept is very important concept to understand glaucoma treatment. Okay, the glaucoma, the concept of glaucoma, everyone clear?
Yes,
Everyone clear
sir.
about glaucoma?
Yes, sir.
Okay.
Yes, sir.
So what happen in glaucoma? Ecosummer increase. Okay. So what is the principle of glaucoma treatment? You must decrease the ecosummer. How you can decrease ecosummer? You can block the production. You can increase the absorption. How you can increase the absorption? Open the angle. Open angle. Okay. Open your angle. Like increase the size of angle. How you can increase size of angle? By doing meiosis. So meiosis done by M3. So drug acting on M3 will help you in glaucoma. Understand? So if can you use drug block M3 in glaucoma? If you block M3, so what happened with the angle? If you block M3, it means you doing mydriasis.
Yes.
Okay. So
Yeah.
listen here. The cholinergic, write a sentence here. Cholinergic antagonist. Okay, you blocking. We learning here agonist. So cholinergic antagonists are contraindicated in glaucoma. Write this sentence. Cholinergic antagonist contraindicated. Never use. Okay. If you use cholinergic patient having glaucoma, and you using drug cholinergic antagonist in glaucoma patient, the patient become totally blinded. It's your fault because you not have good knowledge. Understand? So cholinergic antagonists we never use in glaucoma. If patient having glaucoma must take care about this. Okay, not directly use cholinergic antagonist. So cholinergic antagonist and sympathetic system agonist we never use in glaucoma like this. Understand? So how we can decrease ecosummer production? What receptor here? Here we having a receptor beta 1. Just write receptor, later we learn in sympathetic system. Okay, beta 1 on ciliary body. Okay, beta 1 on ciliary body. M3 receptor on lens ligament. M3 receptor on ciliary muscle here. M3 receptor present on iris. Iris having two receptors. So I already explained here. Iris having two receptors. So iris having M3 receptor, also having alpha 1. Clear? Because iris having two muscles here. Alpha 1. Understand? The receptor location clear? This is the iris. Iris having receptor M3. Also having receptor alpha 1. Done. Alpha 1 dilate and M3 constrict the pupil. Yeah. And also we having M3. Also we having M3 here on this muscle. Okay. This I explain in when we learn cholinergic antagonist. Very also we use in eye procedure. Okay. Ciliary body having which receptor? Ecosummer production. Done by ciliary body. Which receptor on ciliary body? Beta 1. So if you block beta 1, it means you the beta blocker also used in glaucoma, very effective. Yeah. because they decrease the production of ecosystem. Clear? So these type of drugs we use. This effect is very, in this system, the complicated thing only I'll explain. Okay, everyone clear about this concept? Must keep in mind, okay, what happened in eye. Okay, now come back on drugs again. The first drug we done, pilocarpine. Second drug, bithanicol. Second drug, bithanicol. Third drug, carbachol. Third drug, carbachol. Okay, these drugs are direct acting. These drugs direct acting. Okay, next group we having yesterday explained. Which group? Stigmine, neo, physo, pyrido. Okay, pyrido, neo, physo, riva stigmine. Okay, all are stigmine. Next, tacrine. Next, galantamine. Donepezil. So all these drug group indirect acting. Okay. Last one, ecothiopate is also indirect acting. Ecothiopate is also indirect acting. Okay, now I try to explain what's mean direct acting, what's mean indirect acting. So all these drugs, they're doing what? All these drugs, they help acetylcholine increase. Understand? Directly or indirectly, they're helping. All these drugs helping acetylcholine. So that's why we give the name to these drugs. These drugs are agonists. Yeah, because they're helping a which system? Cholinergic agonist. Clear? Cholinergic agonist. Okay, now I explain what's mean of direct and indirect acting. It's a nerve terminal. It's a postsynaptic membrane. Okay. Acetyl, what receptor here? It depends upon we're using what receptor. Maybe nicotinic, maybe muscarinic, maybe M receptor, maybe N receptor, maybe 1, 2, 3, 4, 5. Okay. And acetylcholine released from here. Yeah. It's the acetylcholine. The acetylcholine attached here. If we use drug, for example, pilocarpine, we use drug bithanicol, we use drug carbachol. These drugs, okay, these are drugs directly attached with the receptor. Oh, they're doing the same thing like acetylcholine. Yeah, this is the acetylcholine here. It's the acetylcholine.
Sorry, sir.
Yeah?
We restart the room. It's
Okay,
time.
restart the room.
Okay.
Restart the room.